तो हेलो गाइस, वेलकम बैक टू न्यू वीडियो ऑफ माय चैनल। तो मेरा नाम है आकाश। तो आज हम इस वीडियो में पैथोलॉजी का रीनल सिस्टम का एक टॉपिक डायबिटिक नेफ्रोपैथी कवर करेंगे। तो डायबिटिक नेफ्रोपैथी मतलब डायबिटीज़ अलॉन्ग विच इन्वॉल्व्स रीनल इन्वॉल्वमेंट। तो डायबिटीज़ में दो टाइप्स है, टाइप 1 एंड टाइप 2। एक है इंसुलिन डिपेंडेंट एंड नॉन इंसुलिन डिपेंडेंट। इंसुलिन डिपेंडेंट क्योंकि इंसुलिन प्रोडक्शन लेस है बिकॉज डैमेज टू द बीटा सेल्स ऑफ द पैंक्रियास, एंड नॉन इंसुलिन डिपेंडेंट दैट इज टाइप 2 डायबिटीज mellitus is because of insulin resistance shown by the cells, because common reason is obesity. Next, diabetic nephropathy. Renal involvement is the most important complication of diabetes mellitus. Chronic kidney disease along with renal failure is one of the major reasons for the common death in 10% of the diabetics. So type 1 diabetes that is insulin dependent, 30 to 40% cases are seen, and in type 2 only 20% cases are seen. The diabetic nephropathy that includes asymptomatic proteinuria, nephrotic syndrome, progressive renal failure, and hypertension. These are the clinical features of those diabetic patient who shows renal involvement. So when chronic kidney disease along with those who have chronic kidney disease and also have diabetes mellitus are more prone for cardiovascular disease, 40 times more prone for cardiovascular disease. Next, come to the morphological features of the diabetic nephropathy. Diabetic nephropathy causes 4 types of lesions, that is diabetic glomerular sclerosis, vascular lesions, diabetic pyelonephritis, and tubular lesions. Next starts with the diabetic glomerular sclerosis. There are 2 types of diabetic glomerular sclerosis, that is diffuse and nodular type. We will finish both of them. So diabetic glomerular sclerosis, there will be formation of lesions in the kidney, and pathogenesis involves, as there is diabetes, then therefore there is increase in blood glucose level, that is hyperglycemia. Because of hyperglycemia there is a glomerular hypertension, because if there is increase in the blood glucose level, there is also increase in water concentration in that area. So there is a increase in glomerular hypertension causes renal hypertension, which causes deposition of protein in the mesangium and leads to the glomerular sclerosis and finally to the renal failure. How can to control this? Can be easily controlled by strict control of a blood glucose and control of the systemic hypertension, and which leads to the retards the progression of the diabetic nephropathy. And as I told, there are 2 types, diffuse glomerular sclerosis and nodular glomerular sclerosis. First we will finish diffuse glomerular sclerosis. Diffuse, it involves all the parts of the most of the glomeruli. There are pathogenic are there is thickening of the glomerular basement membrane. GBM is glomerular basement membrane, and diffuse increase in the mesangial matrix and with mild proliferation of mesangial cells. And there is capsular hyaline drops and fibrin drops. What is capsular drop? Capsular drop is a eosinophilic hyaline thickening of a parietal layer of Bowman's capsule. I will show a diagram where you can see thickening of the Bowman's capsule. Next is the fibrin cap, homogeneous brightly eosinophilic material appearing on the wall of the periphery capillary or of the lobule. Here in the diagram you can see there is a capsular drop here. Capsular drop is thickening of the glomerular parietal layer of the glomerulus. This is capsular drop, and there is a formation of a fibrin cap. You can see this is diffuse glomerular sclerosis, and also there is a thickening of the glomerular basement membrane, and you can see this is the artery. The artery get hyalinized, diffuse hyaline deposit and of the mesangial matrix. Next, come to the nodular glomerular sclerosis. Nodular lesions of the diabetic glomerular sclerosis are also known as Camilton-Wilson's lesions or intercapillary glomerular sclerosis, which are more common in type 1 diabetes. Nodule is ovoid or spherical. Means there are formation of nodules in nodular glomerular sclerosis, and normal or there will be normal or thickened glomerular basement membrane, and these nodules are PAS positive. Periodic acid stiff. PAS means periodic acid stiff and contain lipid and fibrin. The nodular lesions enlarge and they compress the glomerular capillaries and obliterate the glomerular tuft, which leads to the renal ischemia, and grossly there is small and contracted kidney. Here is the diagram of a nodular glomerular sclerosis. There you can see the nodular hyaline deposits of the mesangial matrix, and there is hyaline thickening of the arteriole and thickened glomerular basement membrane. This is the real pictograph of nodular glomerular sclerosis. Here you can see the nodules 1, 2 and 3 nodules. This is nodular glomerular. Come to the other 3 lesions, that is vascular lesion, diabetic pyelonephritis and tubular lesions. First is vascular lesions, and there is atheroma of the renal arteries, and it is very common in severe diabetes mellitus and hyaline arteriosclerosis. Because of this sclerosis, there is a renal ischemia and resulting tubular atrophy and interstitial fibrosis. Next is diabetic pyelonephritis. It is nothing but inflammation because of a bacterial infections. There is papillary necrosis or necrotizing papillitis is an important complication of diabetes, and it is 10 to 20 times more common in diabetics than in others. Next is tubular lesions or Armani-Epstein lesions. In untreated diabetics who have extremely high blood glucose level develop extensive glycogen deposit appearing as vacuoles. This is known as Armani-Epstein lesions. The tubules return to the normal on control of hyperglycemic state. So on this we will complete our diabetic nephropathy. So if you like this video, please subscribe my YouTube channel and share it. Thank you.